You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
Yeah, absolutely. And that's an interesting point because you're right. Everybody does want to compare all milestones. And yes, we can put feeding in that category. And the interesting thing is that we, even when parents breastfeed for the first year, they still have the mentality that the next step, even if they don't do formula, is cow's milk. So it's just a different form of formula. It's just the plain cow's milk, but so that's another part of our culture that we've been. It's again from marketing, from the dairy industry, that we all need to be drinking cow's milk when we actually don't. So you're right.
Well, I mean, you did the talk. You are a relentless advocate for the benefits of breastfeeding. It can't be that you're just a one-woman army. What exists around you?
So no, it is not just me. So luckily there are many doctors like me. So we have an organization, the Academy of Breastfeeding Medicine. It's actually an international organization, and we are in the process of, at least in North America, establishing a board certification to make breastfeeding medicine a recognized specialty within medicine. But that's a niche that's for problems. So within the medical space, breastfeeding just being part of normal physiology, I think we're starting to get a little bit better. So within pediatrics, there's more and more education given to doctors in training. And obviously we still have the lactation consultants, but I think the most important thing is to have this conversation with everybody to talk about why breastfeeding matters to all of us, not just to those of us who specialize in it, right? Because every doctor cares for women who are lactating or babies who are breastfeeding. And so we have to all understand the basics of it. And that's why I did the TED Talk, is to push for more open dialogue and more consideration of breastfeeding and lactation in normal everyday conditions and physiology. And as a matter of fact, what was I going to say about that? Yeah, I mean, I just think that if we can make it so that it's not just something that people like me who specialize in it talk about, then we will be helping mothers and babies, because most people don't have problems. They just need somebody to answer questions, and you shouldn't have to be they're basic things. Everybody should understand what breastfeeding looks like. But when we start with that baseline again of thinking that the bottle is when little kids have a doll, right? They get a bottle to feed their baby. And so when we start with that as the baseline, then people imagine that breastfeeding is just like bottle feeding, like here's the baby, here's the bottle, put them together. And that the breastfeeding would be the same thing. Here's a breast, here's the baby, and we put them together. But if you actually watch babies breastfeed, you see that there's much more to it than that, again, because the baby has to do the active part of the feeding. And so if everybody just watched that, whether it's medical students, whether it's teenagers, everybody sees that, then they'd understand what's involved, and we wouldn't struggle as much in the beginning with learning how to do it. Does that make sense?
It makes sense, and it occurs to me that there might be another reason. We talked about the sexualization of breasts and stuff, but I think there are countries in the world, there are cultures where human messiness is embraced. We are human, we are messy, we eat, we go to the bathroom, we do all kinds of things that are messy. I believe in the Western society there's been a glorification of lack of messiness, and seems like a bottle versus breastfeeding is neater, cleaner, more packageable, and that's kind of a mindset, don't you think?
Yeah, I agree. That is part of our mindset is, yes, we want everything, yeah, like you said, neat and tidy. But yet I think that we understand that giving birth isn't neat and tidy, although I think they try their best on that too. But we have to see that giving birth, yes, it's hard, but it's worth it. And the same thing with breastfeeding. Yes, it might be hard, but it's worth it. It doesn't have to be neat and tidy for it to be worthwhile. But you're right. There's so many cultural aspects of this that will take many years to chip away at.
I was wondering if in some way, we had the pandemic, and momentarily there were two classes of people, those that got it, those that didn't get it, the and the. I was wondering if in your mind, somewhere deep inside, when you talk to people, and they tell you, oh yeah, I was bottle fed. Or no, my mother breastfed me for 9 months. Do you segregate them into camps in a subconscious manner, or do you not?
No, not at all. Because, I mean, ultimately, there's so many other factors that go into our health and how we got to where we are, right? Like I think of it like my mother-in-law would always say to my husband, well, I smoked when I was pregnant with you and you turned out fine. Well, fine is relative, right? So yes, he's fine, but I don't put him in a camp of mothers who smoked while they were pregnant and mothers who didn't. But, but probably there's parts of his health that could be even better if she didn't smoke. It's the same thing with breastfeeding. We can't put that in, what's done is done. But, and so, no, I don't put them in camps, but it is, I think we get into trouble when we do that, that we can't blame one thing, because it's never one thing that adds up to what the end result is, right?
Especially because we really can't go back in time and change
Right.
it.
We can't go back and change it.
Yeah, so you're launching a new telehealth startup called a TeleLact. Can you tell us about it?
Yes. So again, from the pandemic, we obviously telehealth became much more critical to reach people who couldn't get healthcare in person. But it made us, it's something that was long overdue in healthcare anyway, because even before the pandemic, right, there's people who don't have good access to care because of transportation issues or location or, insurance, things like that. So reaching people where they are with telehealth has been a wonderful advance that came out of the pandemic that was long overdue. And so part of that is lactation. And so we do have more lactation services that are virtual now, because again, not everybody has access to excellent or expert support in the location that they are. But the difference in what we're trying to do with TeleLact is actually to be able to meet that mother's needs in the moment where she's panicking, right? So right after women go home from the hospital, things may have gone okay in the hospital, or at least they maybe had help in the hospital, and then they go home and they feel alone, and it's the middle of the night and they're exhausted and they're unsure and they're struggling in some way. And so it's not that easy to then get help. And so that's when, somebody might say, okay, well, you know what, just give formula, or I'll run out to the store and get you some formula, because we don't know how else to help you. So with TeleLact, we can be that voice of reason, that reassurance in the middle of the night or on, Saturday night, when she doesn't have any other help to turn to. So that's the goal, is for it to be virtual, that it's convenient from the comfort of your own home, but also that it will be at those times where she might be panicking, a mom might be, and just feeling alone, and not even just needing that reassurance. You're doing fine. Your baby looks great. Keep at it. Or giving pointers. So that's what we're trying to do with TeleLact, is to be that resource on demand when you need it.
So in order to combat time zones and maybe even be helpful worldwide, all you need to do really is to have shifts, right? And now you have people 24/7. Is that
right?
Is that, yeah.
Yeah, that's the goal, is to have somebody available 24/7. So wherever you are, or whatever time it is where you are, we have somebody available. So obviously that takes time to grow. So we're just in the process of our soft launch, of just making sure that our process is working before we are able to do that 24/7 coverage. But hopefully within the year we'll be doing that.
Now, I didn't know about a TeleLact until today. How can it be made to be more known as a resource?
So, right, because we haven't, our website is actually not live, but May 1st it will be live. So, yep, TeleLact.com.
So May 1st is just around, very likely, when your TEDx talk is going to show.
Yes,
So it's a
hopefully.
pretty good timing, probably.
Busy time, but yes, good timing as well. So we've been working on it for the last year and getting ready, and then the TEDx kind of took away from some of my time that I had to work on TeleLact. But yeah, May 1st.
So our viewers and listeners, include, actually, they are comprised of anyone who might have a connection to breastfeeding, whether it's men who might have spouses or daughters or granddaughter, whatever it is. I mean, or women, of course. We always like in this podcast to give some immediate and tangible, actions that people can take right now. What would you say to our viewers and listeners at every age group? Maybe they are young, maybe they are just married, maybe they are fathers, mothers, what would you say they can do now?
Correct. So yeah, there's something everyone can do. So the first thing is just start learning. So pay attention if you know someone who is breastfeeding or who's thinking or is pregnant, to why they're doing what they're doing, what challenges do they have, what successes. So just start learning as a younger person, especially if you haven't reached that stage of your life. The more you know, the better educated you are, then you'll be ready when your time comes. And then for those who already have children, I always want to put out there that there is no shame when things didn't go well, or you weren't able to breastfeed, or you chose not to breastfeed. There's so many reasons culturally why it might be challenging, because there's so many things we didn't get into today, Adiel, so we might have to talk again. But culturally, we need to support women, and if you're an employer, giving her the time that she needs to pump her milk so she can return to work, time off to establish breastfeeding with her baby, so many of those things. If you're a family member, a spouse, a grandparent, a loved one, just advocating for the mothers and babies in your life, because watch my TEDx when it comes out, because a lot of what I talk about is how little doctors learn about breastfeeding. And so because we don't know enough, we actually get in the way. So it's normal that a new parent or a pregnant parent would think that their doctor would be a good source of education in this area, but unfortunately that's not always the case, and so you might get the wrong information. So be skeptical if it doesn't seem to make sense or it doesn't support your goals, and ask somebody else. Find another source of information. So for the loved ones, that's where you can be the advocate to help that mother find more information. Find a good lactation consultant to help. Find TeleLact on the internet when she needs help in the middle of the night. All of that, because it takes all of us in our culture to get on board, to understand that this is important, because mothers are all trying to breastfeed in the beginning. We have 83% of moms starting to breastfeed when their babies are born, but by 6 months, only 25% are still exclusively nursing. So what's going on in between? They're trying, and so we all can step up and be the help to help these moms, whether, again, we're just learning and it'll be in our future, whether we're the loved ones and can give her the support, whether we're the employers that can support those moms, pregnant and breastfeeding moms, so that they do come back. We don't have to train somebody else. I've always done that as an employer myself. My staff brought their newborns back to work with them and carried them in a carrier and breastfed at work, and we all took turns helping out. So those, obviously not every job can do that, but if you can, why not? Why not support that mother to come back to work and keep that valuable employee? So yeah.
So it occurs to me too that again, the issue of work and So people once again, but I think about another thing. I remember when my children were babies, they were breastfed, but I remember there was a communal effect of needing the instant gratification for the child to make steps in their evolution. Are they crawling? Are they standing? Are they and everything? Again, we are very competitive in the West here. Everything is like a milestone. My child was walking at at 11 months, so you're only 13 months. It's so better than the Joneses type thing. It occurs to me that maybe they look at it, even the people who do breastfeed say, okay, you begin breastfeeding, that's like 101. And then you graduate to formula, that's 201. And then you start eating sauces and baby food, which, by the way, is a whole other story. And then you eat solid food. So it's almost like steps in evolution, where step number 1 is breastfeeding, where actually breastfeeding should probably be step 1 through 5.
Yeah, absolutely. And that's an interesting point, because you're right. Everybody does want to compare all milestones. And yes, we can put feeding in that category. And the interesting thing is that we, even when parents breastfeed for the first year, they still have the mentality that the next step, even if they don't do formula, is cow's milk. So it's just a different form of formula. It's just the plain cow's milk, but so that's another part of our culture that we've been. It's again from marketing, from the dairy industry, that we all need to be drinking cow's milk when we actually don't. So you're right.
Well, I'm not a zoologist or a biologist. I'm in a totally different kind of science. But even with my ignorance, I believe if I look at a human baby, they are very helpless for a very long time. I remember even my first baby, so helpless, we used to be able to leave her in the middle of the bed and go out of the room knowing at that stage she wasn't going to move much. Well, a baby cow, a calf, completely different, so to speak, animal, no pun intended, they walk. So, how could somebody, even in their wildest thinking, compare the nutrition that's made at this incredibly beginning, helpless life form that's going to need years to come up with a big, ready to face life almost in the first day calf? It's a different animal. Why is the milk even relevant? I don't get it.
It isn't. It's just it was a convenient herd animal that we could, take milk from. I mean, there's nothing special about a cow other than it was a domesticated farm animal that we had access to.
Well, I guess sometimes it's in the name, because remember the whole last 50 years with the issue of fat. So now most nutritionists, most people will say there are fats that we really need that are very good for us. But in the past 30, 40 years, just the word fat had a bad connotation. I don't want to get fat. I don't want fat. Fat. Bad word. So here the word is milk. Cow's milk, bat milk. I don't know what. It's milk is milk. No, this is not. I know you call it milk. Maybe we should call it Kevin or Johnny. Maybe the word milk is a bad name.
You're right. Because we hear milk and we think, okay, drink one milk, drink another milk, right? But it's not at all the same. The composition, as you said, is completely different for a baby cow than it is for a baby human.
You don't need to be a great zoologist to realize that. I hike on a mountain right next to my home, and in this period of the year, they graze cows. I walk next to those cows, and I'm a tiny little human. I'm not a tiny man, but next to the cows, I'm a gnat. I mean, they are very different than us, I will say.
Yeah. And then we have big brains, they have small brains. I mean, there's so many parts of it.
Stomachs
Yeah.
and yeah. So I mean, to, I don't get it, but you said something that intrigued me a couple of minutes ago. You said there's so much we didn't cover today. So can you give me one or two things we didn't cover?
Let me think about what else I think the I think just so many of the cultural aspects, and because when we dive into breastfeeding too, so I can talk in generalities, but if we look at different socioeconomic groups, different races, I mean there are so many more cultural hurdles that certain groups have to get over. And so while we give statistics for everybody, if you look at different locales or different races, that there are more struggles that we need to be addressing. And in our country, we address it by, we give more formula, right? Instead of we in medicine, I mean, they've done plenty of studies showing that we assume that certain races aren't going to breastfeed. Like they're just not going to, and that's not really the case. And so we need to be supporting everybody. Imagine if, any hospital, no matter where you went and you give birth, that everybody around you is there to just help, to help you, not just get out of the hospital, but to help you breastfeed. Isn't that what we should all expect? So have a healthy delivery. So, there's a lot of conversations happening about the disparity in birth outcomes between, Black women and white women, for example. The same thing with breastfeeding. But it, shouldn't as a society we be demanding that any hospital in America, that you should be able to go in and have a healthy delivery, and you should be able to breastfeed, because everyone there that's what they're there to do, right? But that's not what happens. So there's so many societal issues that need to be addressed, and not just about a mother's choice. Because mothers are making good choices. Like every mother wants the best for herself and her baby, right? But she needs the information and the resources to support those choices, and we're not giving that. So that's one thing, But again, big societal issues that you and I can't fix, but at least we can start conversations.
Well, having gone to medical school, I'll ask you, how much was breastfeeding covered in your medical school?
So I very little, in physiology class, it was mentioned, right? But again, the information actually was pretty outdated in how it actually works. So, and again, learning physiology in a textbook of this cell does this hormone affects this cell, and then this cell does that, is a whole other world. That's like saying, how do we make a baby, right? The sperm and the egg get together and make a baby. I mean, when you simplify it like that, nobody's really actually understanding. So that's basic. That's all it was covered. And then in school, then I was in residency, and part of our OB rotation was just follow around a lactation consultant, I think, one day. That's it. And as a matter of fact, this is a funny story. So one of my co-residents, we were at a lunchtime lecture, and it was a breast surgeon talking about breast cancers at this lunchtime lecture. And she was talking about a kind of cancer that affects the milk ducts. And so one of my co-residents, he said, he's looking at the slide she had up, and he said, "Now, wait a minute, there's more than one duct?" And she's like, "What are you talking about?" So again, even though he'd had anatomy class, we dissected breast tissue things, but in his mind, he still had that bottle nipple image with one hole, right, with milk. So he's still picturing a breast as one hole where milk comes out. And here he is, like a year away from being out of residency, and he's already a doctor, and that's, to me, like exemplifies like doctors knowledge base when it comes to breastfeeding. So we do learn all about pathology, so problems with the breast, but not the normal physiology. And again, the act of breastfeeding isn't like putting a bottle in the mouth, so a baby's mouth. So when doctors don't actually visually watch mothers breastfeed, they have no idea what it's supposed to look like and what is supposed to happen there. So yeah, so that's, again, in some pediatric programs now it's getting better with education and more breastfeeding education. But if you're going into some other specialty, you don't learn. But if you're a surgeon, this happens all the time too in hospitals if a mother might have a C-section when she delivers her baby, right? She has a C-section, there's anesthesia involved, there's pain medication afterwards because she had her abdomen cut open. And we do that, and we know that then she can still breastfeed. But if that same or another mother ends up having to have surgery in her postpartum period, say her gallbladder out, something, those same anesthesiologists are telling the mother, no, you can't breastfeed after you had anesthesia, or no, you can't, or the surgeon saying, no, you can't breastfeed because you're taking pain medication after your surgery. But where is that disconnect coming from when we know perfectly well that we can do this? But yet they just automatically don't think. They think lactating, okay, no, I think some of it comes from pregnancy, because we obviously know we can't use a lot of medications on pregnant women, but that's completely different, and they should understand that, right? When you're pregnant, your baby's getting your blood, the same blood circulation. So the things that go into your blood go into the baby's blood through the placental circulation. With breastfeeding, if I'm taking a medication, eating it, I have to digest it and metabolize it and then put some of it into my breast milk. So it's a tiny amount. And even then, a lot of times it's something we could give to a baby, and they're just getting it in a much lower dose. So if they thought about the pharmacology of it, the physiology of it, it would make sense. But because it was something they never learned, they don't stop and think about it.
So as an auxiliary question, when you were in medical school, how much was spent on nutrition?
About the same, very little. It's the same, exactly the same.
And yet so many
The basis of health, and yet we don't learn about it. That's for dietitians to learn about, not doctors.
Yeah, but so many
Which
people,
makes no sense, right?
yeah, but when you put on a white coat, the patient immediately gives you amazing powers to tell them what to eat, how to eat, and you may be talking completely out of turn because you didn't really
Right.
learn.
Right. You didn't really learn. And so that's the same thing. Yeah. And so you might, whatever the current fad diet is, or whatever you've read, or whatever you do personally, you might tell your patients, or you just say, oh, go see the dietitian. I don't know. So, and the same thing with breastfeeding, doctors, I mean, it's better to say, go ask the lactation consultant, I don't know, than to give an answer. But, that their only answer might be, again, what they heard, what their own personal experience was, because here's the thing, it's like doctors are just like everybody else, and we don't know what we don't know. And so it's not until, especially if you're a doctor that went through training and you didn't have children yet, and then once you first have your first child, and then you're breastfeeding, or your spouse is breastfeeding, that's your first education. That's the first time you go, huh, I don't think I ever learned anything about this. And so that's when some doctors do come to be more, have more interest in educate themselves, or they only know their own personal experience. So then that's the answer. Well, then you just do this, or, well, it was really hard, so I gave up. So you can give up too. I mean, so they're giving answers based on their anecdotal experience, which is never good medicine.
Well, you strike me as a doctor who would be one of those people who said, you know, I don't know much about it, go ask somebody else, but I would venture to say that a very big percentage of doctors are being held to a godlike standard by their patients, and they don't want to let them down. So they disseminate the information from Mount Olympus, even though it's based only on half a course studied 30 years ago, in medical school.
It's true. It's true. I mean, and it's doctors, and it's sort of human nature too, right? We're not comfortable with things we don't know or fully. So rather than saying, you know what, I don't know, that's a good question, let me find out, or let me find someone who does. I mean, and many doctors do that. but but it's too easy to say, oh, and just give an answer like you said from Mount Olympus. um
Actually, it's not only that. I mean, I traveled a lot, and there were a couple of countries that I went to that it took me time to learn that there's another reality that goes on. You go to a person and you ask them, "Excuse me, can you tell me how to get to Plaza so and so?" Well, they don't know. So the normal answer would be, "I'm sorry, I don't know." No, no. In these particular cultures, they start saying, "Okay, go straight here and then make a left." Completely made up just not to let you down, but they are letting you down because they're giving you the wrong instruction. It's just a cultural thing. And I wanted to also make a small analogy. You said that people should be better educated about breastfeeding. It reminds me of something different, but people say that in high school, we should all learn financial skills.
Absolutely.
How to start a checking account, how to save, how to invest. I know it's not as important really, but it is important. But
It
there are many
is.
things we just don't learn, and they throw us in the deep end, and we somehow need to fend for ourselves.
It's true. There are, again, so many real life things that we could be teaching our teenagers in high school, that will serve us. Yeah, I mean, yeah, kids get their first job. They don't know how to sign up for their benefits, and they have no idea about. I mean, we deal with patients all the time, that families that have no idea. They don't understand their own health insurance. That should be something that's taught, right? You should understand what a deductible is, and and other financial things, how to file your taxes, and again, how to feed your baby, right? I mean, these should be life skills that are taught in our school system. I 100% agree with that.
But actually, I now have to take the other side.
Okay.
I'm envisioning a high school in which a finance class is given, and I'm looking at the teenagers in my mind's eye, and they, oh, not this boring class again. Oh my God, deductibles. I'm sick. I have fever. I'm gonna miss. It's like I want to miss that class. But one thing I wanted to ask you, you did mention a postpartum. What about postpartum depression, and how can that affect or be mitigated by breastfeeding?
Yeah, so well, it's both, right? So it can, some postpartum depression or anxiety mood symptoms can be mitigated by breastfeeding, but also it can impair breastfeeding because this mother is struggling. And so we definitely need to do a better job of intervening and helping with this. So it goes both ways. Yes, it can stabilize her mood by breastfeeding, but it can also, some people have a baseline of depression, anxiety, go off their medication because they're pregnant, and then or it's just triggered by postpartum hormones, and it impacts their ability to breastfeed and to care for their baby. So that's why going back to having the support system there from family to be there, because in our culture we have this mentality that we have to be able to do it all on our own, right? Asking for help is weakness, instead of all gathering around. If we all supported each and every mother and baby, for a full 6 or 8 weeks, like they do in other cultures, where she's not expected to do anything except for recover and feed her baby, and we do everything else. We help her with as a society, as a community, help her with the other children, with the housework, and all of that. But no, instead, we have moms that have to go back to work, because they have no paid time off. We have people whose husbands can't take time off to help with the other kids. And so all of these things are what's contributing to so much postpartum depression. And again, she's feeling like a failure because she thinks everybody else is able to do all of this and she's struggling. And really, nobody can do it. We're not meant to have to do all of that ourselves.
Karen, I want to thank you very much. I know you're busy. You took the time to be here. I'm sure that many of our viewers and listeners are going to benefit. This is also going to be recorded and out there forever, hopefully. And so hopefully many more people will. So I want to once again extend my gratitude and thank you so much for being with us today.
I appreciate you, Adiel. Thank you for having me and for having this podcast to expand people's minds about other aspects of health.
All right. Bye-bye.
Bye-bye.
Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.